The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. You know, today we're living through a chaotic time, a very difficult time, and people are dealing with stress that absolutely makes their lives very difficult. And my guest today is Scott Miller, who knows how to take care of problems that exist as a result of stress and as a result of all the time that we're dealing with all of this. I want to say, I can't help it. I want to say just crap, okay? Sorry for that word, but needless to say, it's very important that we understand that people are dealing with so much. And I want to welcome to my show Scott Miller. And Scott, it's great to have you on the show.
Well, as always, Sue, thank you very much for having me on the show. It's always a pleasure, and I'm happy to be here.
You know, Scott, here you are having a very interesting business, which is a physical therapy business. And because of the stress that we're dealing with today, you must see so many people who are affected by that physically and also mentally, but for the most part physically. Explain to our audience what it is like now and during these chaotic times to deal with people.
Well, you know, we're not only dealing with our normal, you know, everyday orthopedic type injuries at our physical therapy office. We're seeing a very large effect of you know, patients and people just being very sedentary over the last several months. So that's been a whole nother aspect of treatment to our office, and you know, risk factor for, you know, that sedentary lifestyle is just a lot of weakness, balance issues, low back pain, knee pain, and that's something that we've been certainly dealing with now more than ever. And then, you know, on the other hand too, you know, they're, you know, just dealing with everybody's just stressful, you know, attitude and nature about just being inside of a place, you know, during this crazy pandemic, and we're trying to make patients as safe and as comfortable as possible with you know, what we have done here at the office, and it's certainly not easy.
You know, I'm interested in understanding how it's affected you, because we just talked about how it affects your patients, but the question is, how is it affecting you? You
know, it's certainly has affected me in you know, a lot of different aspects. You know, both here at the office, trying to make things work and trying to keep my business afloat and trying to keep my patients safe and keeping a job for my employees, which, you know, I have you know, everybody has stayed on board the whole time, which has been something that we're, you know, very fortunate to have been able to do, and to keep everybody working. You know, so that's certainly one stress that we're dealing with, just to make sure, you know, we're, you know, kind of going through our daily flow with keeping everybody safe and keeping my business, you know, up and running. And then, of course, on the home front, trying to keep my family safe and my kids safe, and, you know, having them, you know, having to deal with the stresses that are the everyday stresses that they're dealing with during this pandemic.
You know, Scott, you could have done virtually anything. You could have gone to school to become a doctor, a lawyer, you name it, but you chose physical therapy. There's got to be a reason why you chose this particular career.
Certainly, you know, I think most individuals that are physical therapists really do enjoy and gain a lot of satisfaction with helping people. You know, I do have a tremendous satisfaction on you know, getting people better, rebuilding their bodies to, you know, the level that they were at before or the level that they desire. And then, you know, two, you know, one of the other big reasons why I got into this industry is because I was a patient myself, you know, before I became a PT, and I really saw what it can do, and, you know, how I felt before my injury and how helpless I felt, and how the PT got me through that and got me back to playing sports and back to my daily life. So that really, you know, catapulted my interest into this field.
Yeah, and now that you're doing a lot of physical therapy on quite a lot of people, what are you finding is the most important thing that if a person was shadowing you, for example, you had a PT that is a kid that came in, he's interning for you, and he shadows you, what would be the first thing that you would show him and discuss with him?
Usually what I tell my students is that, you can have all the book knowledge and know every little body part and every single, technical term out there. But if you do not know how to talk to people, and you don't know how to be, empathetic to patients, sympathetic to patients, and you do not have good personal skills, you're not going to make it in this industry. More specifically, in a setting like my practice, which is a general orthopedic type facility. It's just that is the number one thing that you really need to succeed in order to make it in this field.
Well, Scott, what types of patients do you normally see? I'm sure, and I'm a patient of yours, and I'm telling the audience that I think it's an amazing experience that I'm having with you, because I have a shoulder issue, and you're dealing with it in such a good way that I find myself feeling better and better and better. But what I want to know is, you see a lot of elderly people today, and elderly people, they're vulnerable to this virus, and they come to you in a lot of pain. And working with an elderly person, sometimes they're feeling very depressed and anxious. Not because, they're not feeling well. They're all alone, many of them. Now, when they come to you, the scenario of, let's start from the beginning with them. They sit on your table, and you say to them what?
Well, I need to get a history of what is going on with their current condition, what brings them into physical therapy. Obviously, they're, especially with the elderly patients these days, and with their pre-existing conditions and just their age, they're not trying to gallivant around town and go to out and about to all these places, because they're trying to be safe, and so obviously the PT is very important to them as well. So we need to get a nice little history of what brings them in and what needs to be treated. And, we try to, on that first visit, which it's a lot of talking. The evaluation is performed at that point. Pretty extensive history taking is done, just to get an idea of what's going on and what we really, need to do to get this patient back on the right path. And we have to establish a plan of care at that visit, so we can accomplish the goals that we're trying to attain.
Yeah. Do you work with any other healthcare providers?
Yes, we do. We don't work directly with a lot of healthcare providers. We are in touch with a lot of patients' physicians that do refer them here. And, we send them our, evaluation notes, and we send them progress notes. And, if we need to, speak with them on the phone, we could be, we can certainly give the doctor office a call and, ask them any specific questions with regards to a surgical procedure that they did with a patient, or, if there's something that might be just out of the maybe outside of the scope of physical therapy, and we kind of want to run some things by the doctor to do with the patient. It's certainly something that we feel comfortable doing, and we speak with physicians all the time regarding patients.
That brings me to asking you the question, what are the most rewarding experiences with the patient? I'm sure you've had patients that are, unique in many ways, and when you deal with them, you see that they're so happy that you're helping them. So the question becomes, again, what is the most rewarding experiences with the patient today?
Are you talking just today, or just in general?
In general, actually.
In general, it really is very rewarding when, we are appreciated by the patient, and, we do, you hear out there's a lot of thankless jobs, but, this job, and is one of the reasons why I do enjoy coming to work every day is because, we do get a lot of thank yous throughout the day, and people are very appreciative of what we do for them and how we make them feel better. So, that is very, very rewarding, and it's really most rewarding to see the patient's progress. And when the patient starts with treatment and they maybe come in with crutches or a wheelchair or a walker, and, whether it be 4 weeks, 6 weeks, 8 weeks later, and they're walking without any assistive device, and they constantly are praising us, saying, I wouldn't be here and wouldn't be doing this without you guys. So that's very, very rewarding, and that's kind of why we do this.
Yeah. Now, sometimes people come into your office and they're very difficult patients. Some people, that's the way they are. They can't help it. Their personalities, kind of translate into yelling at you, saying, I don't know if I trust you. Now, when somebody does something like that to you, okay, and they say to you, to one of you, to you or one of your physical therapists, they're not trusting you the way they should, how would you respond to them?
Well, there certainly are a lot of difficult patients out there, and we probably can write a book and have a wall of fame for all of our difficult patients throughout the years. But we always say that we have a secondary degree in psychology that help us deal with a lot of the difficult types of patients, and just not even difficult, but different types of personalities, and you really need to be adaptive to different patients' personalities. And you also have to realize that, when someone is in a lot of pain, usually you're not in that great of a mood. So, we try not to take things personally, and we try to explain to patients why we're doing something, what we're doing. And, if a patient continues to, outright just be rude to us, I don't have any patience for that, and I don't have any tolerance for that in my office. And if somebody is outright mean to one of my therapists, I will ask them to leave. So, it's not something, we don't tolerate that. And, we understand patients are maybe not in a good mood and a little grumpy, but, they are in pain, and we got to respect that.
Yeah. There are many diseases that people have. Starting, I'm going to give you, real serious indications of what kinds of diseases people come in, like spinal cord injuries. Now, that is really a difficult person to work with, I imagine. Traumatic brain injuries, concussions, headaches, jaw pain, dementia, cerebral palsy, incontinence, pneumonia, multiple sclerosis. There are so many diseases that people have, and when they come to your business, for help, is there a different way in which you deal with these people? Because their physicology, is that a word? Their physical being is different than any other person that you see who just maybe have a shoulder pain, a back pain, you name it. So when they come into your office and you see what they're up against, what do you say to them?
For one, my practice does not. We don't treat a lot of a lot of the low level neurological patients. So when you do have patients with severe spinal cord injuries or a severe traumatic brain injury, or somebody that's very low level stroke patient, there are other facilities that are better equipped for patients with with those conditions. And then when they become a little higher level and more functional, then certainly they would be kind of transferred or passed onto an outpatient facility like mine. But we, with any type of patient, with no matter what is going on, we look at what their problems are, and we have to set goals from where their problems are, and we work from there. So we would really treat that patient no different than somebody who has difficulty moving their arm because they have pain and they can't lift something overhead, as opposed to someone who cannot move their arm at all and is in extreme pain. We have to take things incrementally and take things step by step, and we have to set realistic goals for that patient. And as long as we do that, we're making good progress.
Let's talk about sports athletes. Okay, athletes come to your business all the time, and let's talk about football for the moment. And there was a time that football players were really getting smacked and hit, and they were developing all kinds of brain damage and problems. Okay, now with that in mind, do you ever treat athletes, and if you do, is there a difference in how you treat them? Because, again, unfortunately, they have problems getting smacked, getting hit on the head, you name it. So what about athletes?
Well, athletes we're going to treat them no differently than most of our other patients, except the fact that, some of the, their expectations and their prior level of function is going to be a lot higher than that of someone who is maybe just trying to rehab a shoulder so that they can drive a car. Whereas, an athlete is going to be, we're trying to rehab them so that they can, pitch 7 or 8 innings of a baseball game or play in a football game. So, the goals are going to be set differently, but we're still going to have the very same objectives of trying to eliminate their pain, trying to increase their range of motion, trying to improve their function and getting them back to what I said before, just back to their prior level of function, whether that be, professional sports, high school sports, or just your 65-year-old weekend warrior who is going out to play some tennis. There's really no difference, except the level of play that they're at. So it's we're going to treat them very, very similarly.
Scott, you have a newsletter, and the last newsletter that I saw talked a little bit about nutrition and how important it is to have a good diet. Now, one wouldn't think that a PT would talk about that, but you do. And what do you recommend for people with regard to nutrition?
Well, we usually have a little nutrition aspect of all our newsletters because we have a nutritionist and a dietitian that is on staff here that works here full time, and she sees patients here at the office and virtually as well to set up nutrition plans, to set up specific diets based on their goals. Again, whether it's just somebody who wants to lose 5 or 10 pounds, or it's an athlete who wants to perform better, who wants to lean up, or who wants to bulk up. So she is highly educated and experienced with nutrition. So she contributes to our newsletter and adds a lot of different articles on maybe some good things to be eating at different times of the day and with different activities. So and her name is Allison.
Yeah. Well, it's interesting to hear about the fact that you have somebody in your office who deals with nutrition, but the question also becomes kids. Now, we're dealing with obesity. Obesity is a big problem in our society today. And with regard to obesity, when people have that, when they're overweight like that, they have a tendency, if I'm correct, and tell me if I'm correct, they have a tendency to have all kinds of problems with their back, with all kinds of other parts of their body. Now, is there a difference? Do you treat kids in a different way because of this issue that they're dealing with?
Well, it really depends on what kind of issues that they're dealing with. So sure, if we think that a lot of their orthopedic issues and maybe their back pain or knee pain or any other type of pain is being contributed by the obesity or being overweight or something going on with nutrition, we oftentimes do refer them to Allison, our nutritionist, or we have them speak with their physician about some type of weight loss program, because whether they're a child, an adolescent, an adult, just 5 or 10 pounds makes a big difference on your joints. So it's and with children, it's just a little bit. Sometimes it's easier to change it at that point in their life, and they don't have a lot of orthopedic issues at that point. So we try to talk to them about what increased weight does to your body and how that can be changed.
There's a song out there, and I'm sure you know it, that everything is connected. Your bones, your ligaments, you name it, they're all connected. So with regard to that, there is a tendency, if I'm not wrong, I mean, maybe I am, and if I'm wrong, I want you to tell our audience what the right thing is. probably most of the injuries that you see are attributed to ligaments. Am I correct about that? And if not, tell our audience a little bit about, what is really the most important part of one's body that needs to be taken care of.
I wouldn't necessarily say the ligaments. The ligaments basically are is the soft tissue that's holding, that connects a bone to a bone. Probably the most important aspect of the body is keeping your muscles strong and mobile, and your tendons. Your tendons are what connect your muscles to the bones. So every little joint, every muscle that is moved, you're moving that tendon in order to move that joint. So if you have weakness, it's going to cause an abnormal stress in that tendon, and then that's going to cause an abnormal stress inside that joint. So it's all it's all cyclical. It all happens together. So if you have a little weakness in your leg muscle, it's going to put stress on the tendon that attaches into the knee, and that's going to certainly correlate to a lot of knee issues. So, the objective with anybody that comes in with knee issues is that we need to strengthen all the muscles around that joint. If you strengthen up the muscles around that joint and loosen up the tendons and the muscles around that joint, it usually results in improved pain levels and improved function for that joint.
Yeah. Now, today, we're dealing with the pandemic. We spoke about that. People talk about it all the time. But when did you start working as a PT?
I became a PT in 2004.
So what is the difference between what you experienced then and what you're experiencing now?
For one, the surgeries have gotten a lot better over the years, which ultimately, makes the outcomes with the PT better, and you're not going to be needing as much PT after surgeries, and the pain levels are that much less after these orthopedic procedures. So they've gotten a lot less invasive, which ultimately, correlates to improved function and enable you to return to most activities with most of these new types of procedures. That's the biggest change that I've seen in the 15 years that I've been doing this.
That's important for people to know. Now, do you have any tips for observing people in your physical therapy clinic? There must be a lot of tips that you can give our audience, so I'd like to hear what you have to say.
Just tips in general to just the general population, or just in general for PT specific?
Well, let's just say for people in general, because people are dealing with a lot of issues and they don't come to a physical therapist. So I would like them to know a little bit about what you have to say, because what you have to say is also about your experiences with people. So therefore, let me hear what you have to, say to people, everyone.
No, absolutely. And I would say the most important thing that I usually see with patients here throughout the years, and that usually what causes quite a bit of issues in someone's body, is when their muscles and their joints tighten up a lot. And that usually correlates to, kind of what I was saying before, when the muscles and the tendons get tight. It can put abnormal stresses on the joint, which ultimately causes a lot of joint issues. So, my suggestion to everyone, even if you're, feeling pretty good, is just always make sure that your joints and your muscles are mobile. You want to stay active. You want to stretch out. You want to make sure that you don't have a lot of tightness in the muscles and the joints, and usually that leads to healthier tendons, healthier muscles, and ultimately healthier joints. So, that's it's very, very important to be proactive and prevent and practice preventative physical therapy rather than be reactive with the treatment.
Wow. Well, my guest today has been Scott Miller, who practices in a place called Delray Beach, Florida. And I'd like you to tell our audience a little bit how they get in touch with you. And, do you have any newsletters that you send out to them, and how do they get them if they're not on your list? And have you ever considered writing a book? You let us know. I'd like our audience to know a little bit about you.
Sure. Absolutely. My website has all the information that you can possibly need on physical therapy and my practice here in Delray Beach. It's Miller Physical Therapy, and that's miller-pt.com, or just Google Miller Physical Therapy in Delray Beach, and you'll come right to our website. I have hundreds and hundreds of articles and information about the entire body and all different injuries and all the body parts and different things that could be done for, how treatment works and what could be done for different injuries. There's also a place on the website that you can email me directly, as well as sign up for our newsletter. So everything is right there on the website, and it's a lot of really good information.
Well, my guest today has been Miller Physical Therapy, located in downtown Delray Beach, and it's really an amazing place where you can get healed and really get great advice. So thank you again, Scott Miller, for being on the Susan Brender Show. It's been a pleasure.
Thank you very much for having me. It certainly is always a pleasure.
Okay, thank you.